worse when they read or go on a screen, a computer screen, but the day they haven't read much, the day they haven't used the screen, they don't get. So seek medical advice when you get this kind of headaches. How do you treat them? The management of primary headaches are very typical. Your healthcare worker will make the diagnosis and give you proper treatment. The management of secondary headaches depends on what is causing. Epilepsy is a very common disease in our setup, and unfortunately, patients who have epilepsy are locked away because of this stigma about epilepsy. So we see a very small percentage of patients who have epilepsy. Most of them are locked away. Family don't want to tell people that their children or their spouses or their relatives, their loved ones have epilepsy. And this is a wrong thing. The stigma around epilepsy should be fought. Epilepsy is a very controllable disease. The word is controllable. Some epilepsies cannot be cured, but you can control it, just like somebody who has, say, hypertension. You are not able to cure hypertension, but you can control the blood pressure very well with certain drugs. You are not able to cure diabetes, but you can control diabetes very well as long as you take the appropriate medication. Epilepsy can be controlled very well as long as the appropriate diagnosis is made and the appropriate treatment is given. Now, what is epilepsy? Epilepsy results from a surge of electrical activity in the brain. It's like a normal electrical wiring system, and you get a short circuit and you get a spark. In fact, you could equate it to, say, a thunderstorm. Somebody is quiet and then all of a sudden there's a lightning, a surge of electrical activity within the brain nerve cells, and this results into what we know as a seizure. Now, if you get several of these seizures, the electrical activity surge in the brain, which may manifest differently, but the primary thing, the electrical surge activity in the brain results in a seizure. If you have repeated seizures, you then have what you call epilepsy. So epilepsy is recurrent seizures. A seizure is a sudden surge of electrical activity, which is an abnormal phenomenon in the brain. Epilepsy is divided again into, just like headache, into primary and secondary epilepsy. Primary epilepsy is often genetic. There's a strong family history. Family members, the father, the parents, brothers or siblings, brothers and sisters, or uncles, first nuclear family or extended family. So it's a very strong family. It's a genetic basis to it. Primary epilepsy tends to start early. It starts from the age of about 5, 6, 7 years. Usually primary epilepsy would have started before the age of 19, 20 years. Now, secondary epilepsy is caused by like a secondary phenomenon. Somebody may have a brain tumor and develop epilepsy because of the brain tumor. Somebody may have infection in the brain and develop epilepsy. Somebody may have had a head injury and develop epilepsy. Somebody may have had an ear infection, which causes infection to spread to the brain because the ear is very close, at a certain point is very close to the brain, and they develop epilepsy. It's a secondary epilepsy. So as you realize, secondary epilepsy, the management depends on what is causing it, but of course, even patients who have secondary epilepsy are given the same medication as patients who have primary epilepsy to control the epilepsy. But if it is primary epilepsy, those are the only drugs we give, the so-called anti-epileptic drugs. If it is secondary epilepsy, you will give the anti-epileptic drugs, and at the same time, you will manage what is causing it. If it's meningitis, you treat it. Whether primary or secondary, epilepsy can be suspected when you see certain signs. There are certain signs that when you see, And everybody knows when they see somebody jerking and falling down, biting their tongue and passing urine, it is epilepsy. That is probably the only common sign that we all know. What somebody does when they jerk is called a fit or a convulsion. And most people know that and think that is the only form of epilepsy. There are several other forms which may present with very mild presentations. Some patients may just present with blank stares, like I could be talking now and all of a sudden, and then I come back. I could have had an episode of an epileptic attack. These are called partial seizures. And when they're recurrent, we call them partial epilepsies. So we have the so-called generalized tonic-clonic epilepsies, and then we have the partial where there is either memory lapse or a brief confusion, or I could be holding a pen or even a cup in my hand, and then I just realize it has dropped. And when my awareness comes, I wonder how the pen dropped. I can't quite connect. So those are signs which we need to look for. In school children, some of the presentation may be very, very, very subtle, very, very soft. A school child may be said to be hard-headed. The teacher says, whenever I talk to this kid in class, he just stares at me and doesn't answer back. It is not that the child is stubborn. The child could be going through mild epileptic attacks. Epilepsy is diagnosed from history. This is why some of the things I've demonstrated, some of the things I've said need to be noticed, so that when you take your child to the doctor, when you take your brother or sister to the doctor, when you take your spouse to the doctor, if you notice any of the things that I've mentioned, please mention them to the doctor. They will help the doctor make a proper diagnosis and start appropriate treatment. And that would mean doing tests like what we call encephalogram, electroencephalogram, EEG, which is a test that shows brainwave, just like the electrocardiogram, which most people know, gives you electrical activity of the heart. This one gives you electrical activity of the brain. The other investigation, which is very important in diagnosis, proper diagnosis of epilepsy, is MRI scan of the brain. But again, MRI scan of the brain is expensive and only very few people. Now, the essence of doing all these investigations is to make a diagnosis. Is it primary epilepsy? Is it secondary epilepsy? And therefore, how do I manage them? Am I dealing with a generalized tonic-clonic epilepsy, or am I dealing with partial epilepsy where there is loss of memory partially, drops partially, falls partially? Because the treatment is important on the kind of diagnosis that the doctor finally makes. Epilepsy is managed by different medications, and the choice of medication depends on what classification the doctor or the medical provider makes. Patients who present with generalized clonic jerking movement have a certain class of drugs they are given. Patients, particularly children, who just get blank episodes and they have certain characteristics on the EEG, have specific medication. So the diagnosis is very crucial in choosing the right treatment. If, let's say, for instance, you are seen and you are told you have a certain form of epilepsy, and the doctor chooses drug A, the doctor will adjust the dosages of the drug until they reach a level when you have convulsions or absence attacks or blank spells are properly controlled. You will then be on treatment, well controlled, but on treatment for a minimum period of 2 years. After 2 years, again, you do not stop drugs immediately. After 2 years of no attack, whatever form of the attack it is, then your medical provider will gradually reduce the dosages. Let's say if you're taking a tablet which is, let's say, 400 milligrams at night, once a day for an adult. After 2 years, when your doctor is happy, you will not stop your drugs immediately. the doctor will reduce it from 400 to 300 for maybe 1 month. If you don't have an attack, drops it to 200 every night for 1 month. If you don't have an attack, drop it to 100 milligrams at night for 1 month. If you don't have an attack, you may drop it to 50 milligrams or eventually stop. Now that depends on which drug you're using. The way it is dropped, how fast it is dropped, what dosage is dropped depends a lot on the drug you're using. But it's important that you must take your drugs regularly.